Hello, my name is Dr. Farman Ali and I'm a GP, family physician. Today we will be talking about a very common topic called blood pressure or hypertension. So what is blood pressure? High blood pressure happens when the force on the walls of the blood vessels is more than normal. This means that the heart has to work harder and the blood vessels are under more strain, thus making it a major risk factor for heart disease, stroke and other serious conditions. Today we will be talking about the major risk factors for high blood pressure, how to measure and diagnose blood pressure, the investigations that you may require when you are diagnosed with blood pressure, the optimal targets for blood pressure and what it should be. Last but not the least, the treatment options that you have without medication and with medicines. So, what are the risk factors for high blood pressure? Blood pressure is more common in patients with diabetes. These include both type 1 and type 2 diabetes. People who come from the Afro-Caribbean origin are more at risk of developing blood pressure. Those people who are from the Indian subcontinent, and if you have a family history of high blood pressure or cardiovascular diseases, you may be at risk of developing hypertension. Some people with certain lifestyles can also develop high blood pressure. These include patients who are overweight, those who eat a lot of salt, if the patients do not take enough exercise, those who drink a lot of alcohol, and patients with a lot of stress. So how do you diagnose blood pressure? Remember, a one-off high reading is not a diagnostic of having blood pressure or hypertension. So when you take your blood pressure, you usually come with two figures. For example, I took my blood pressure earlier today and it was 126 by 77. The top figure is called the systolic, and this is the measure of the pressure inside your arteries when your heart is pumping the blood out. The lower figure, the diastolic pressure as it is called, is the pressure inside your arteries when your heart is relaxing between beats. The third number is the heart rate. It was at 90 beats per minute. It is usually less than that, but maybe I was a bit nervous. As we said, a one-off blood pressure reading that is high does not mean that you have hypertension. Your blood pressure varies throughout the day. It may be high for a short period of time if you are anxious, stress, pain, or if you have been just exercising. For blood pressure to be diagnosed, the blood pressure has to remain persistently above 140 by 90 in clinical settings or 135 over 85 in your home. Now, one of the reasons that many people get high blood pressure in clinics is a term called white coat hypertension. These people become anxious when they attend medical clinics, and hence this should not be labeled as hypertension. For these type of patients, you can have ambulatory blood pressure or home blood pressure monitoring to rule out that it was not a one-off rise in blood pressure. What is ambulatory blood pressure? Ambulatory blood pressure is a small machine that is attached to your arm and takes recordings usually over 24 hours period. As a rule, the average ambulatory blood pressure readings gives the truest account of your blood pressure. If we can't have that for any reason, home ambulatory blood pressure monitoring is a good alternative to that. So what happens in the home blood pressure monitoring? You can monitor your blood pressure and record your blood pressure for 7 consecutive days at your home. Now, on each day, you take 2 blood pressure readings, one in the morning between 6 a.m. and midday, and another one in the evening somewhere between 6 p.m. and midnight, usually 12 hours apart. On each occasion, you will take 2 readings, one after another. Give a minute or so in between these readings. Record these readings on a piece of paper, or you can download the chart from many different websites and drop these readings off to your GP. So once you have dropped off these readings to the GP practice, they will take an average out of the blood pressure readings, and if the average is high, they will contact you to diagnose you with blood pressure. So if you are diagnosed with blood pressure, your blood pressure may fall into one of the 3 severity stages. Stage 1. This is when the blood pressure is higher than 140 by 90 but less than 150 by 99. Or if the home blood pressure is higher than 135 by 85 but less than 149 by 94. Stage 1 blood pressure does not usually require a treatment. You only treat it in certain individuals. Those people who have got an established cardiovascular disease such as previous stroke, diabetes, kidney problems, and those people who have an estimated risk of cardiovascular disease of more than 10%. Your GP can calculate that by using certain risk calculators such as QRisk3. Stage 2 hypertension. This is diagnosed when your blood pressure is higher than 160 by 100 but still less than 180 by 120, or if your home blood pressure or ambulatory blood pressure is higher than 150 by 95. This requires a treatment straight away. Stage 3 hypertension. This is diagnosed when your blood pressure is more than 180 or the diastolic blood pressure is more than 120 on repeated readings in any settings. This requires urgent treatment. If we go back to the diagram, if your blood pressure is less than 140 by 80, you do not need to do anything. Recheck it in 5 years' time. If the blood pressure is higher than that mark, you may be asked to go and do some home blood pressure monitoring. Again, if it is less than stage 2 hypertension, you do not require treatment unless you have got some underlying health problems. If the blood pressure is more than 180 by 120 on repeated readings in any settings, treatment is commenced straight away. So what are the symptoms of high blood pressure? High blood pressure usually does not have any symptoms. That is why it is known as a silent killer. Occasionally, some patients may report headaches if the blood pressure is very high. Some people feel a bit dizzy or their vision may be affected, and that might be the only signs that they give you in clinic. What investigations would be required for anyone diagnosed with blood pressure? First is a urine test. This is to check loss of proteins or blood in the urine. To see, a blood test is also required to check if the kidneys are working normally, and also to check the cholesterol and glucose levels. Heart racing, also known as ECG, is also required. Your doctor may look into the back of your eye, called a fundoscopy, to look for any damage caused by persistent high blood pressure. So, the treatment for blood pressure. What can you do to manage your blood pressure? First thing is to lose weight. If you are overweight, aim for a BMI of less than 25. Reduce the salt intake in your food. Take regular exercise. The Department of Health recommends 30 minutes over 5 days every week. Stopping smoking. Although this may not have direct impact on the blood pressure itself, but it will have an impact on other associated cardiovascular diseases. Medication for blood pressure. There are 5 main classes of medication that are used to lower the blood pressure. They are called the angiotensin converting enzyme inhibitors. Number 2, calcium channel blockers. The third one is water tablets or diuretics. These include both the thiazide type diuretics and spironolactone. The fourth one are the alpha and beta blockers. The fifth, more complex one, they are called the centrally acting antihypertensive medications. The choice of medication, it depends on many different factors. If you have an underlying health problems, you might be started on certain tablets. If you are of a certain ethnic origin, such as Afro-Caribbean origin, you might be started on a different type of medication to start with. Whether you take any other medications, potential side effects from certain medications might dictate the choice. Hypertension with diabetes require a treatment with ACE inhibitors or ARBs as they are called. They are indicated in the top left-hand corner of the diagram. Those without diabetes fall into 2 categories: those under the age of 55 and those over the age of 55. Patients under the age of 55 are started on ACE inhibitors or ARBs, while those above the age of 55 are started on calcium channel blockers. Patients who are from the Afro-Caribbean origin may be started on calcium channel blockers. If a second drug is required, you choose from the opposite group. For example, if a patient was started on ACE inhibitors or ARBs, you add on calcium channel blockers. And vice versa, if somebody was started on calcium channel blockers, you add in ACE inhibitors or ARBs. If another medication is required, you add in thiazide-like diuretics such as indapamide or bendroflumethiazide. If further treatment is required, you may choose spironolactone to be the fourth drug. At this point, your GP may consider referring you to the hospital for further investigations and to rule out any other causes for high blood pressure. So, what are the different types of medication that are used? ACE inhibitors, as they are commonly called, angiotensin converting enzyme inhibitors. The common examples are enalapril, lisinopril, perindopril, or ramipril. How do they work? They work by reducing a chemical called angiotensin 2. This chemical tends to narrow the blood vessels, and if this is reduced, the blood vessels relax and widen and you don't have high blood pressure. One of the most common side effects of ACE inhibitors is an irritating cough. Patients who are started on ACE inhibitors requires a regular monitoring of their kidney functions, and you may be asked to have a blood test in 2 to 3 weeks time after starting the medication, or whenever your doctor chooses to change the dose of medication. The other group is angiotensin receptor blockers. The common examples of this are candesartan, irbesartan, losartan, valsartan and olmesartan. Again, you would require a monitoring of the kidney functions whenever you are started, or if the dose is changed for these medications. You may be required to do a blood test in 2 to 3 weeks' time. They work along the same pathway as the ACE inhibitors by blocking the effect of angiotensin 2 on the blood vessels. That is why these cannot be given in conjunction with ACE inhibitors. In other words, they cannot be given together. The most common side effects for ARBs is dizziness. Calcium channel blockers. Common examples of these include amlodipine, felodipine and nifedipine. There are some other ones such as diltiazem and verapamil. Calcium channel blockers work by affecting the way in which calcium is utilized in the blood and heart muscles. This has a relaxing effect on the blood vessels. The most common side effects of calcium channel blockers are dizziness, sometimes facial flushing, very commonly swollen ankles, and constipation has been reported. Diuretics, or commonly known as water tablets. They are used to treat blood pressure. Diuretics or water tablets, they work by increasing the amount of salt and fluid that you pass in your urine. This has some effect on the circulating fluid inside your blood vessels and hence reducing blood pressure. Also, it has independent relaxing effect on the blood vessels, which again reduces the pressure inside your blood vessels. The most common water tablets are thiazide type diuretics. They include the bendroflumethiazide or indapamide. Spironolactone is another stronger water tablet. Sometimes it is used as an add-on when the blood pressure cannot be controlled with 3 medications. You may require a monitoring of your kidney functions. The most common side effect of water tablets is gout attacks in small number of users, and those who already have gout may report worsening of the gout. Erectile dysfunction has also been reported in certain users. The next group of drugs are alpha and beta blockers. Beta blockers include medicines such as atenolol, bisoprolol, carvedilol, metoprolol or propranolol. They work by slowing the heart rate down and reducing the force of the heart. These actions lower the blood pressure. These medications have fallen off the favorite list as they were before due to recent emerging evidence, and hence they are not used as the first line. However, in certain individuals, those with cardiac problems, it may be started as a first line. The most common side effects of beta blockers include cold hands, feet, sometimes a poor sleep, tiredness, and impotence has been reported in certain users. Remember, patients who have asthma or COPD should not be using beta blockers for blood pressure. So, what are the targets for optimal blood pressure? This is the most commonly asked question, and patients will ask, what should my blood pressure be? Remember, if you are below the age of 80, your blood pressure in the clinic should be below 140 by 90. If you and your home blood pressure or ambulatory blood pressure should remain below 135 by 85. Those patients who are above the age of 80, their clinic blood pressure should be below 150 by 90, or their home or ambulatory blood pressure should be below 145 by 85. In most cases, you will require the blood pressure medication for life. However, in certain patients whose blood pressure has been well controlled for 3 or more years, discuss it with your GP and your medication may be stopped, but do not stop it on your own. Thank you very much.